thinking about Alex. Keeps feeling like somebody's missing. All right. Well, he is. But I think by now I keep looking for him. I know he's gone. All right. Do not become distracted by dramatic open wounds. Don't neglect airway obstruction. No. That's the thing. You arrive on scene in an accident. Oh, good grief. His head's covered in blood. And that's what you concentrate on. So checking to see if the guy's breathing. And when you get them all cleaned up and all, it's coming from a, little cut that's going to leave a scar, but, the head bleeds real bad, and his face was covered. Unfortunately, he's dead because you neglected the breathing, but you did clean his face off really good. Something the mortician won't have to do so much of now. Okay? Soft tissues of the body can be injured all different ways. Some people have tried most of them. All right. Death is often related to hemorrhage, bleeding, or infection. Can often be prevented by simple protective actions. Perhaps you wear a helmet riding a bike or a motorcycle. Perhaps you wear leather clothing. Perhaps you wear a seatbelt. Perhaps, you so on and so on. All right? The skin, body's first line of defense against external forces, heat, pressure, you name it, and infection. The skin is amazing. Very few germs can actually get through the skin. If a germ enters your body, typically it's through mucous membranes, breaks in the skin, that sort of thing. Very few germs actually can penetrate the skin itself. Right. In all instances, the EMT must control bleeding, prevent further contamination to decrease, chances of infection, protect wounds, apply dressings and bandages to various parts of the patient's body. Skin varies in thickness. Gets thinner, baby skin, very thin. Elderly people, you try to bandage and their skin just tears, with tape, okay? All right? You may not be able to put tape on an elderly person's arm. You may use Coban, Does everybody know when I refer to Coban? When you get on the ambulance, you'll see it, it's just, it wraps around and it's kind of sticks to itself, but it doesn't stick to the skin.
I would call it like athletic wrap or something.
Athletic
like
wrap,
yeah.
whatever. Yeah, Coban's actually, I think, a brand name.
Okay.
All right. Thinner in some places, like the eyelids, the lips, the ears, and so on. Okay. Skin has two principal layers: the epidermis, that's the dead layer on the outside, and the dermis, which is underneath. Okay. It's the epidermis. That's basically dead. You can take a needle, and if you just keep it just under the layer, you won't feel anything. Okay. Maybe some pressure, you won't feel any pain. That skin's dead there. All right. There's your dermis, it's got all this stuff in it. Then underneath it is the subcutaneous, below the skin layer. All right. Skin covers all external surfaces of the body, and any openings are lined with mucous membranes, and that mucus helps stop contaminants and germs and whatever from coming in through those openings.
There are mucous membranes in our ears.
Well, you have wax.
Oh,
there.
okay.
But I don't know if that would actually be considered a mucous membrane. But that's true, because it does say all openings. I don't know if they consider the ear an opening because you have the tympanic membrane, in other words, the eardrum. Sir?
It's a membrane. Well, you
So-
said mucous membrane.
Oh, it
Eardrum
is a
still
membrane, but I don't know if the ear is actually considered an opening because of that membrane, but yeah. Provide, okay, so the watery substance that lubricates the openings provides a barrier against bacterial invasion. Okay, alright, skin keeps pathogens out, keeps fluids in. That's why in the case of a burn, these people can dehydrate quickly, okay? But you don't have the skin there to keep the fluids in anymore. Helps regulate body temperature. That's our biggest way of regulating our body temperature is through the skin, okay? Any break in the skin may allow bacteria to enter, increases the possibilities of infection, fluid loss of temperature control. All right, you can have your closed injuries, all right? That's, Blake punched me for going over time. I've got a closed injury, all right? Damage is beneath the skin or mucous membrane. Skin's still intact, damage is below it. All right, open injuries. All right, he punched me. I said, oh my goodness, he's bigger than me. I ain't gonna worry with my fist, so I come back with an open injury on him, okay? That's a break in the surface of the skin or mucous membrane. Now we got deeper tissues that are exposed to contamination, whatever contaminants were on that knife blade. all right, and burns. So basically, we have blunt force trauma, penetrating trauma, and burns. All right. And burns doesn't have to just be you touched a hot surface. It can be a chemical burn, an electrical burn, you name it. All right. Primary concern is going to stop the bleeding. All right. And the next wound healing stage is going to be inflammation. Inflammation, the body is sending a lot of blood to that site. That's why you'll see it turn all red. That's why you'll see it get warm, because the body's trying to heal itself. All right, and it moves a new layer of cells in. So the body stops the bleeding, then it gets inflamed, and then it moves a new layer of cells into the damaged area. All right, new blood vessels form. Collagen provides, or basically a scar, provides stability to the damaged tissue and joints, wound borders. I think collagen is what you see in a scar, I think. All right. Closed injuries, this is pretty common sense. Discoloration, a black eye, discoloration that's bleeding under the skin, swelling, the eye swells, all right, swelling beneath the skin. Remember, that's fluid buildup, edema. Pain, history of blunt trauma. All right, a contusion, that's a bruise. It just means it's bleeding underneath the skin, so you're seeing the black eye, but the skin's not broken, all right? Buildup of blood produces blue or black ecchymosis. Ecchymosis is the color, all right? That's, if you say the patient's exhibiting ecchymosis around the eye, I mean, you got blue or black around the eye, okay?
Would you just say he had a black eye?
Yeah.
Okay.
I'm probably not gonna call it a hospital, say ecchymosis, around the patient has a black eye. But if you see the word ecchymosis used somewhere, that's what it's referring to. It's just discoloration because you've got to have a contusion, or in other words, a bruise. It's just blood under the skin. A hematoma is actually a puddle of blood under the skin, if you will. If where I run into it is when I'm starting an IV, typically on an elderly patient, and the vein blows, and you're just, it just swells up with blood under there. I've sometimes taken a tourniquet, like an IV type tourniquet, and put it on there to contain it, because it just keeps going and going. Some of these people, they're on all kinds of blood thinners, and their blood vessels are in poor shape, and they're, a couple times or so, I've actually, used not tourniquets, main tourniquets, but what we call tourniquets for IVs. So that's a puddle of blood basically under the skin, okay? Not a bruise. Crushing injury. I think everybody knows what that is. All right. When an area of the body is trapped for longer than 4 hours, crush syndrome can develop. All right, crush syndrome. Crush syndrome is, what we're worried about here is, word is eluding me, but it's when your cells die, and so the walls of the cells collapse and the contents of your cells spill into the bloodstream, and there's a word for it, and I can't think of it. But what happens is, let's say this guy was working on his car, the jack slipped, the car fell, it's pinning one leg. All right, somebody finds him there 6 hours later, he's been laying there. All right, you're called. Again, you have the well-meaning folks, and they don't know, race out there, yank the car off of them. But the problem with that is that blood that's not been able to circulate, from that leg is very toxic now, because it's highly acidic. It hasn't been circulating and getting cleaned. You've had tons of cells die in that leg because you're not getting the fresh blood down there. You're not getting good perfusion, good oxygenated blood down there. That word keeps on eluding me. But at any rate, this blood is very acidic. So you take the car up, the guy goes, oh, and then he dies. All right, what happens is that blood, it gets pumped back and it hits the heart, and it'll throw the heart into a bad rhythm, this highly acidic, toxic, poisonous blood, okay? So what you want in this, right here, this crush syndrome, what you want in this type of thing is you want ALS, and what they're gonna do is start an IV, and they'll do two things. One, they'll get fluids running, and two, they'll give bicarbs, yeah. Words are really eluding me tonight. Yeah, they give sodium bicarb, and what that does is it neutralizes the acid. Okay, sodium bicarb is a base; it's alkalotic. Okay, so it neutralizes the acid, and the fluids will stop all those solids that are in the bloodstream from those dead cells from jamming up your kidneys. Okay, from causing renal failure. Or we hope it does. We're trying to flush the kidneys. Okay. All right, so they say 4 hours or greater. So something to keep in mind there. All right, oops, all right. Compartment syndrome results from the swelling that occurs whenever tissues are injured. So that's when we have, well, let's get a little bit farther into it here. All right, Deputy D. All right, the wound's contaminated. Okay, it's 4 types of open injuries. You'll hear abrasions, lacerations, avulsions, and penetrating wounds. An abrasion is simply, I slipped and got carpet burn, okay? Abrasion, the skin is kind of worn. You might get a little seepage of blood from capillary bleeding through it. That's an abrasion, okay? A scrape. A laceration is a cut. An avulsion is where a piece of tissue or a whole body part is actually, how would you say it was a good way to describe it? Yeah, it's like folded back, like, like you tear a chunk and fold it back, okay? It's not amputated, it's like still holding on by something, but it's a chunk that's ripped back, all right? They'll have some pictures here. And a penetrating wound. You got stabbed. All right, there's an abrasion. See, like a burn, I was running, I slid, and like a carpet burn on your arm kind of thing, all right? Caused by friction. Body part rubs or scrapes across a rough or hard surface. Just the superficial layer of the skin, maybe you get a little capillary bleed. All right, laceration. See a jagged cut. See right there, these cuts? There. And they're kind of honing it here a little bit. An incision is a sharp, smooth cut. We might say a surgeon made an incision. Okay, where a laceration is just any cut, Sir?
What did they do to the back of their leg?
I don't know. Looks rough though, doesn't it?
Yeah.
This is an avulsion. See, it separates various layers of soft tissue so that they become either completely detached or hang as a flap. So this right here, I don't know if you can see it from back there, that's you looking right into the leg, okay? There's a big chunk that's been torn back. Here you go, see like this right here, see how it's kind of like a big chunk is torn back? We call that an avulsion.
Weren't you telling us about somebody who got their back of their leg stuck in a bed frame? I guess he was moving.
Oh, yes. But now that was just a severe laceration. I mean, that was just a straight cut, maybe, like that, and all the way down to where it's so deep you could watch the muscle moving up and down in the leg. Yeah,
That's
that was
cool.
very neat. Somewhere I still have that video.
Wouldn't that be the one with the calf that was hanging off them? That
The
was
last
too drunk
one?
to-
Oh, that?
I think that's the one he was talking about.
No, I was talking about the one he said.
Yeah.
Oh.
But that one you're
was
talking
the
about
lady
sounds
that
pretty
kept
cool.
sliding her face off.
Wait, hold on. She what?
She kept pulling her face off, but
Like,
I don't know.
like
what
her
you call
face
that.
was, like her face was separated from her.
Yeah, she had cut. It was like a half moon or a banana, like
Mhm.
all the way to the skull, like this. And so she was very drunk, and she knew something was wrong, but she just didn't know what. She kept telling us, "Just take me home, I'll super glue it." She would reach out and grab her face and kind of pull it down from her skull there.
What?
Just a minute, lady. No, it's okay. You really need to go to the ER.
Yeah.
Not the super. I don't know. I mean, it was a cut. I don't know if you would. I don't think it was like ripped like an avulsion, but all right.
Texas Chainsaw Massacre, man.
She was real drunk and tripped. Those concrete things like you pull your vehicle up and it stops you. I don't know what you call them in a parking lot. Yeah, they're just like about like so. And she had walked out of a bar or club, something, tripped over one of those and caught somehow. That's how we heard it, you know, it was with easy, some things are kind of, it was an interesting.
Yeah.
An amputation, that's when it's cut off, all right? Piece gets cut off. Completely severed, all right? Stabbings and shootings often result in multiple penetrating injuries, all right? Assess them carefully to identify all wounds. I told you, you know, my story of the wound that got missed. I wasn't the medic, but still I was there. Count the number of penetrating injuries, determine type of gun when possible, but don't delay transport, okay? Blast injuries. I remember we said, you know, we got the immediate, you know, the pressure wave, you know, we have the shrapnel, we have the third ring where, you know, maybe thrown against something, the fourth thing where, you know, maybe burns and so on from the blast, all these kind of things, all right? All right. Okay. Consider the possibility of a closed injury when you observe the bruising, swelling, deformity, etc. Okay, there may be something wrong inside. All right, scene size up. It's like on the others. The very first thing, I know I've repeated it every time, but scene safety. Hopefully it starts with your dispatcher, but before you get out of the ambulance, what's it like? Whatever injured my patient, you know, may injure me. All right, observe the scene for hazards to your crew, bystanders, and the patient before you ever get out of the ambulance, and keep on observing. If you need any additional resources, take the necessary standard precautions. Put on your gloves, in other words. Be careful where you put your hands, okay? So on. Focus on controlling the bleeding. Take a look at the MOI, you know, keep your eyes open. Mechanism of injury. Go to your primary assessments. Are there any immediate life threats? All right? You know, your general impression, your ABCs. Am I going to transport immediately, or am I going to stay on scene just a little bit more? Remember, with trauma, typically we want to be gone a little bit faster than we do with medical. Okay? These people, you know, that need surgery, they need to get going for surgery. All right? Remember your primary assessment, ABCs. Do we need high flow oxygen? Do they have an open, you know, patent airway? Do we need any C-spine protection? Are we going to protect the spine and the neck? Any DCAT, BTLS, your circulation, the skin color, temper condition, your pulses, capillary refill time, your transport decision. Remember, if these people have an altered level of consciousness, shock, severe pain, difficulty breathing, etc., you know, this is, you know, we get going. We don't stick around, stay in place. Your history taking. What happened? Okay, some folks appear to think that we have a magic diagnostic machine. You know, we point it at the patient and it comes up with a reading of what's wrong. And we just have to ask, you know, the family sometimes is screaming at you to go. Sometimes the patient is, get going to the hospital. Well, I really need to know what's wrong where I can do something for him en route. Do you have any medical history? Your sample, get your sample. Your OPQRST, remember that's done for pain. Your onset, does anything provoke or palliate? You know, does anything make it better or worse? Quality, describe the pain. Radiation, does the pain move anywhere? Severity, scale of 1 to 10. 1's very little pain, 10's the worst in the world. Tell me which it is, what it is. And time, you know, how long has this been going on? What's, you know, does the pain come and go or stay steady? All right? So those three. And you'll have to have those three memorized for your practical exam. You actually use those on the practical exam, okay? The instructor's gonna check them off letter by letter, you know, giving you points. All right? The patient's unresponsive, medical, well, here we're talking about trauma, so it's gonna pretty well be bystanders, family, whatever, hopefully, or a little bit of detective work maybe on your part. Typical signs of an open injury. We've all had open injuries. Are they bleeding? Is there a break in the skin? To be an open injury, there must be a break. All right, they may be in shock, maybe hemorrhaging, bleeding, disfigurement or loss of a body part. Okay? If they're missing an arm, definitely an open injury. All right, now we come to our secondary assessment. Remember, that's your head to toe, your vital signs, all of that. All right, full body scan. Typically, notice it said occurs en route to the emergency department. When we were doing medical, it said you may do it en route. Trauma, you typically get going a little bit faster, okay? They've got a major bleed, they've got an amputation, a bad avulsion, all these kind of things. We get going. You do this en route to the hospital, or you may not even be able to get to all of it. All right, so you're listening to your breath sounds, you're getting your vital signs. Assessing the neurologic system. In other words, squeeze my hands. What finger am I touching? Move your feet. You want to make sure that everything's working. Vital signs. Vital signs. All right, reassessment. Every 5 minutes, remember, for an unstable patient, and for 15 for a stable patient. Your vital signs and chief complaint. Check it every 5 minutes or 15 minutes. Check your interventions, and your tourniquets and pressure bandages and whatever. Make sure there's no changes in the patient's condition. All right. Patients have traumatic injuries that impact the airway or ventilation, or those that might go into shock. They've lost a lot of blood. Give these patients oxygen. Expose all wounds, control bleeding, be prepared to treat for shock. Cut the clothes off. All right, don't remove any material stuck in the wounds. Let the hospital handle all that. Splint any extremities that are painful, swollen, or deformed. Okay, you can make one effort to, if it's deformed off to the side, to put it back in place. But if there's any resistance or anything, don't force it. Just splint it the way it is. All right, communication and documentation. Describe the mechanism of injury, how you found the patient, how much blood you think they lost, location, description of wounds, size and depth of the injury. It was a 5 centimeter laceration, approximately ½ centimeter deep, right side of the forehead, whatever. What you did for it. All right. Treat closed soft tissue injury using the Rice's mnemonic. I personally don't use that mnemonic, but if that's how you want to remember it. Rest, ice, compression, elevation, and splinting. Signs of developing shock. You learned that in the shock chapter. They may start to get anxious. They may start to get agitated. They may start to get restless, as they get low of oxygen. Changes in mental status, altered mental status. The heart rate starts to pick up. The breathing rate starts to pick up. They start to get sweaty as the stress of the sympathetic nervous system is kicking in. Okay, cooler, clammy skin, decreased blood pressure. Often the last sign to go. Okay, we're getting shot. All right, cover wounds of the chest, upper abdomen, or upper back with an occlusive dressing. Remember we went over that. We don't want a pneumothorax. Okay. You see it, you can put your gloved hand over it first and then put an occlusive dressing, something plastic, something air can't get through, not a 4x4, not gauze. Control bleeding, direct even pressure, elevation. If that, then your pressure dressings and splints, and lastly, tourniquets, okay? All right. You can control bleeding. I've never actually done this, but by the book, you can control bleeding by splinting the extremity. Even if there's no fracture, it keeps them from moving that extremity so much, so that the blood vessels are not constricting and dilating, and so that helps to control the bleeding. Abdominal wounds. Open wound in the abdominal cavity may expose internal organs. In an evisceration, the organs protrude through the wound. I went on a shotgunning in Gould. The guy was laying on the floor, and his guts, his insides were on the outsides, okay? And here you see the guts. Here's this belly button right here. The guts coming out, the intestines, the internal organs. That's an evisceration. All right, cover the wound with sterile gauze. Secure the gauze with an occlusive. An occlusive means you can't get through it, okay? It blocks off. Keep the organs moist and warm. These people can lose heat at a rapid rate. All right, very rapidly. Right. Notice how they covered it up. You'll have trauma dressings for that on the ambulance. Impaled objects. We leave it in unless it prevents us from doing CPR or blocks the airway. Okay. So if the object's in the cheek or mouth and it's obstructing the airway, you can remove it. If it's in the chest and you can't do CPR, you can remove it. Yes, they may bleed out when you take it out, but if they're needing CPR, in other words, if they're going to die anyway, then you life over limb, you make the effort, you try to remove it because they were going to die, without the CPR. Neck injuries. Open neck injuries can be life-threatening. The veins right here, you have major veins in the neck, they're at very low pressure. You get a bad cut to them, if they're open to the atmosphere, they actually can suck air in and you get an air embolism. It's like a pump getting airlocked, okay? You get air in the veins, and that's like having a thrombus, it's like having a blood clot. All right? Cover the wound with an occlusive dressing, apply manual pressure, but don't compress both carotid arteries at the same time. It's the same thing as putting a tourniquet around the neck, okay? You got a bad head bleed, you can't put a tourniquet around the neck. If you compress both carotid arteries at the same time, remember, you deprive the brain of blood 5 seconds or less, they're gonna go out, okay? And it's gonna get worse from there. Occlusive dressing. Small animal bites. Small animals' mouths heavily contaminated with virulent bacteria, and actually a human's mouth is even worse, I believe. All right. Major concern is the spread of rabies. Nothing you can do about that. Human bites. Human mouth contains an exceptionally wide range of bacteria and viruses. I think they say our mouths are worse than animal mouths. All right. Regard any human bite that's penetrated the skin as a serious injury, infection. All right. Emergency treatment. Well, this is kind of getting. I mean, yeah, it may get infected, but this is getting pretty serious. I wouldn't so much worry about immobilizing the bitten extremity with a splint, but apparently by the book. But that's good. But what we're worried about is infection, okay? These people may be given antibiotics. All right, burns. Approximately 3,400 deaths per year, and this is among one of the most serious and painful injuries of all. Not only is it serious, not only is it painful, this can be life-altering. If the patient survives, I mean, this can be disfiguring. This can alter quality of life by the scar tissue, how it prevents things from happening. Burns are really serious, okay? And like I say, it doesn't just have to be heat, all right? The burn is just when the body's receiving more radiant energy. More energy is sent into it than it can absorb. This can be chemicals, this can be electricity, this can be thermal, which is heat, all right? Complete assessment. Children, older patients, and patients with chronic illnesses are going to shock faster with burns. All right? Well, if you want to know the exact temperature, thermal burns occur when the skin is exposed to temperatures higher than 111 degrees. All right? Let's see here. Severity of a thermal or a heat burn correlates directly with these things. How long was, your hand in the flame, etc. Right. When a person is burned, the skin that acts as a barrier is gone. Your body's defense is gone there. So people, in fact, if I'm not mistaken, infection is the biggest killer of folks that have burns. They die, isn't that right? It's infection that's the biggest killer. It's not the trauma from the burn or whatever, it's infection. Right? Again, hypothermia, these people lose heat at a rapid rate without the skin there. Hypovolemia, they lose fluid, they dehydrate. It's not that they're bleeding from there, but they lose fluid at a rapid rate. And shock. All right? Burns to the airway are of significant importance. You may not even see burned as in burn, but this can be people that have breathed superheated vapors or been in a house, people that come out with the charring and soot in their mouths and stuff. These people may have breathed in air that was hot enough to burn the airway. And they may still be breathing, may still be talking, but it may start to close up, okay? Circumferential burns of the chest can compromise breathing. This is when you get a burn like around the chest. It can be anywhere, but they're saying chest. And as that burn will start to constrict, okay? It's almost like putting a tourniquet on, okay? It'll start to constrict the skin and body's tissues. It'll get tighter, okay? It lead to neurovascular compromise, irreversible damage. It's like a tourniquet. Burn severity. All right, patients younger than 5, older than 55 are at increased risk of complications from burns. Depth of burns. We used to say first, second, third degree. Now we say superficial, partial thickness, full thickness. Superficial is your sunburns, okay? just affects the outer layer of the skin, it's nothing much. Partial thickness, we've gone through the epidermis and some portion of the dermis. We're into the living second layer of skin. Partial thickness burn. You'll see the blisters on this. Full thickness, or the old 3rd degree burns, you've gone right through the skin and burned down underneath it. The thing about this, you're thinking, oh my goodness, that's terrible. Those are pain-free. You've burned through the nerves there. Now, still hurt terrible, but not actually from that, because you typically don't just get a 3rd degree burn. You know, it's 3rd degree right there, but then you have a ring of 2nd degree and 1st degree, or in other words, a partial thickness and superficial, you know, as it spreads out. Okay? So full thickness, you've gone right through all the skin layers. All right. Notice the sunburn. See the blisters and all, this is the 2nd degree. And this poor guy, you can see he's burned all over. It's gone right through both layers of skin. Now, extent of burns. And I always have to refresh my memory with using this rule of 9s, but there's almost certainly going to be at least one question asking about the rule of 9s, I would think, on it. You estimate the burns, using the rule of palm or rule of 9s. Rule of palm just means that your palm is estimated to be, not your fingers, your palm is 1% of your body's surface. Okay, so that gives you an idea. You know, let's see, about 4%, whatever. All right, or the rule of 9s, and a picture is going to pop up on that. It's very easy to misjudge burns. I took a burn patient to Memphis, to the burn center there, and the ER doctor was estimating it up and come up with like 30-some%, 40%, I forgot what the deal was. And at the burn center, I think they called it 9%. It's easy, to get carried away with estimating on that, okay? We don't include superficial burns when we're doing our rule of 9s or rule of palm or anything like that, okay? Superficial burns don't count. Painful, but don't count. All right, rule of 9s. We count that. The head right here as 9, each arm is 9, 18 here for the, and then it's gonna, again, you've got more around the back. Genitalia is gonna be 1, 18 and 18. And then in the back, you've got 18 for the back, 18 for the back of this, and it will all add up to 100. It will differ slightly with children. Notice the child, 12, the baby, 18 for the head, and that's because if you notice on a baby in proportion, the head is larger in proportion to the body than an adult's head is in proportion to their body. Okay. I always have to look back over that. I forget, because burns is something we don't go on very often. All right. Scene sizing. Observe the scene for hazards and safety. Start with your dispatch before you get out of your ambulance, all of that, okay? Make sure that whatever caused the patient's burns, you don't run into, all right? Going on a forest fire, you don't want to get trapped, in there with the ambulance. Not depending on your boss, because if you, the boss might say, hey, you'll heal. That ambulance costs $90,000, or something. All right, scene sizing. How many patients do I have? What's going on? Do I need any additional resources? Is this my only patient? All the usual, just like that. And we go with our primary assessment. Are there any immediate life threats? My ABCs. Do I need to stabilize my C-spine, my neck there, or the spine itself, so on. All right, airway and breathing, we've already done this. Just notice, remember, the soot present in around the hairway, singed facial hair, beard, nose hairs, I don't care, mustache, if anything's singed, start to suspect perhaps they have some airway burns, okay? Heavy amounts of secretions and frequent coughing may indicate a respiratory burn. Transport decision. Consider rapid transport for a patient who has any airway or breathing problem. These people need to go. If they have significant burn injuries, these people need to go. Significant external bleeding, signs and symptoms of internal bleeding, all reasons to get on the road, okay? Consider if you're on a BLS truck rendezvousing with an ALS ambulance. Investigate the chief complaint. We've gone to history taking. That's next. Remember, scene size up, primary assessment, history taking. All right. What's the chief complaint? What's going on? All right. Typical signs of a burn. I guess everybody knows what a burn looks like. Stop the burning process. You would think this would be obvious, but from what I hear, they say it's amazing how many people get to the ER that the EMT may have done all kinds of things, but there's still smoke coming out of their clothes. They still are burning. You know? First off, stop the burning process.
What if the clothes? Well, I guess you could use saline or something.
Yeah.
Yeah. I was
Whatever
like,
you need,
sometimes
don't
the
transport
clothes.
them while they're still smoldering.
Yeah.
Like bacon.
No, I doubt it.
He's fired back up.
I don't think it'll smell like bacon, man.
Burnt flesh does not smell like bacon.
No, it doesn't. You're right.
It smells horrible.
I'm being,
Imagine what pigs smell whenever we cook bacon.
poor quality children. All right. Apply a dressing to prevent contamination. Treat the patient for shock. Now, on this dressing, I don't see where they've said it. Your book, I think, is going to say dry. The paramedic book, I think, says dry. Their idea is if you use a wet dressing, it helps the growth of bacteria, and already these patients are at severe risk for infection. However, on the ambulance, I've seen paramedics take, now granted it was sterile water, but and pour it on burns. And when I took that patient to the burn center, the hospital gave me a basin and sterile water to pour in the burn as a pain reliever on the way up there. So, but I think your book is going to say a dry dressing. All right, so you want to check with them. Are you having any difficulty breathing? We're doing our sample history. Any difficulty swallowing? Any pain? Okay. Physical exam. Check them out. This is the secondary assessment, head to toe. You're checking everything. The respiratory system, obviously. Neurologic system. Can they, move and feel and everything? Hands and feet. Just because those are the far areas of the body. So you. The musculoskeletal system, in other words, cut the clothes off and make see where they're burned. Reassessment, repeating that primary assessment, the patient's vitals, the chief complaint, everything like we've been doing. Oxygen is mandatory for inhalation burns and large body surface area burns. Give these patients oxygen, okay? Rapid transport. They have to treat for shock. A lot of times when we're talking about careful no lights and sirens, this is a place for lights and sirens, rapid transport. Let the hospital know how much of the body surface area is burned, the depth of the burn. We're talking second degree, a third degree, etc. Where the patient's burned. All right. Emergency medical care for burns. Stop the burning process, prevent additional injury. All right. Thermal burns, as you know, caused by heat. Lightning strikes, called a flash burn. That's produced by an explosion. That could be an electrician. He was working around a big electrical panel and something shorted. It flashed out at him. Lightning, it's a flash burn. Okay, this is still a thermal burn. It's heat, but just a quick poof. All right, stop the burning. Cool the burned area. Remove all jewelry. We don't want them to start swelling and that bracelet all of a sudden become a tourniquet. Okay, that necklace become a tourniquet. All right, all patients, here we are, should have a dry dressing applied. Maintains body temperature, prevents infection, provides comfort. It says say dry dressing. All right, inhalation burns. They breathe in superheated gases, steam. All right, maybe chemicals. Consider requesting ALS backup. They may try to intubate or something. Combustion process produces a variety of toxic gases. We've already talked about that. A couple of you guys are firefighters, you already know. We may be talking about cyanide. That's a number of household items when burnt produce cyanide gas, deadly gas. Carbon monoxide, okay? chemical burns. You ever, strong acids or strong alkalis, either one. Eyes are particularly vulnerable. Wear appropriate chemical-resistant gloves and eye protection. Don't get burned by the same thing you're washing off the patient. If it's a dry chemical, notice they're gonna brush it off before they use water. Water for 20 minutes. For liquid chemicals, of course, you're not brushing it off. Immediately start with water. All right, if the patient's eye has been burned, hold the eyelid open while flooding the eye. Make sure if it's chemicals or something that you're not, got the patient laying on their side and you're putting, they're laying on the right side and you're putting water in the left eye and it's running down and into the right eye. Don't contaminate the other eye, okay? Make sure you don't do that. You may have to hold the eye open. All right, electrical burns. For electrical flow, there must be a complete circuit between the source and the ground, okay? If, you got electricity and you grab it, that's sort of like you see these birds on these power lines. They're not making a complete circuit. The bird is landing on the power line, but it's not touching anything else. However, the electric fence around my garden had a wire about 6 inches off the ground, and I went out one day, and there was a birdie with smoke coming out of him. He was touching the ground and the wire. It's a complete circuit. The electricity was coming into the bird and going out to the ground. But they can sit on those power lines with thousands and thousands of volts, and no harm done. They're not touching anything else. If you had a copper wire, a piece of metal, from the ground, you touch the bird, it just, you fry real quick. All right? An insulator, any substance that prevents the circuit, perhaps you're standing on rubber pads, working on that electricity. Conductor, that's like your wire, any substance that allows electricity to flow. Human body is a good conductor. And electricity will always take the path of least resistance, okay? I happen to be an electrician. If you, electricity will always take the path of least resistance. That's why we use copper ground wires. If there is a short, hopefully electricity goes out the copper ground, to ground and dissipates without shocking anybody, because the copper ground wire provides an easier path than you do. All right. Never attempt to remove someone from an electrical source unless you are specially trained to do so. Be careful about jumping in there. These circuit breakers on these high lines are, if every time that a branch slapped a wire, the breaker through and you had to go out and manually reset it, there'd be servicemen running all over the countryside all the time. So the idea is these things will snap off and back on, okay? So you get out there and you may think it's dead, but that can come back on. All right, keep that in mind. It's got to be physically thrown to be safe. All right, you'll see the burn injury where the electricity enters and exits the body, but it may be all burns internal. Patient may go into cardiac or respiratory arrest from the electric shock. This is where you can use your AED. All right, there's an electrical burn. All right, if indicated, begin CPR on the patient, apply an AED. Their heart is stopped because of the shock. Be prepared to defibrillate if necessary, okay? All right, in recent years, law enforcement has increased its use of tasers, but certain, like when they're in excited delirium, that's produced by drugs, maybe some other conditions, sometimes a taser can send them into a bad heart rhythm, okay? Make sure you have access to an AED when responding to patients who have been exposed to taser shots. Because they can have certain dysrhythmias, cardiac dysrhythmias, and sudden cardiac arrest. Radiation burns. Excuse me. Intentionally released radioactivity in terrorist attacks, various other things. 3 types of ionizing radiation. Alpha, basically your skin stops it. Beta, basically clothes stop it. Gamma, that's why they have to use lead shields. Like in hospitals, the walls in an x-ray room are lined with lead. You'll see them, wear lead aprons and things like that. That's what they use to stop gamma rays. All right, see, most ionizing radiation accidents involve gamma radiation or x-rays. All right. When they get ready to x-ray patients, you need to step back. All right. limit your duration of exposure. The big thing with radiation is limiting the duration of exposure. You know, if you're exposed to this much, it's safe, theoretically, for a certain amount of time. If you're exposed to this much more, then okay, it's still safe theoretically, but for a shorter amount of time. So limit your duration of exposure. You know, you don't just rush in there with only your gloves into a radiation accident, okay? Dressing and bandaging. All wounds require bandaging. Splints can help control bleeding, provide firm support for dressing. Dressings and bandages have three functions. They control the bleeding, protect the wound from further damage, prevent further contamination and infection. Gauze pads. All right. Occlusive dressings prevent air and liquids from entering or exiting a wound. Occlusive just means it blocks it off. Okay, nothing. You can't get through. To keep your dressings in place, you use bandages. Do not use elastic bandages to secure dressings. The bandage may become a tourniquet, okay? All right. Splints are useful in stabilizing broken extremities. All right. If the wound continues to bleed despite the use of direct pressure, quickly proceed to the use of a tourniquet. And review. Young male struck in the forearm with a baseball. Complains of pain to the area. Slight swelling and ecchymosis are present, but no external bleeding. Which type of injury does this describe?
B.
You said C, Tammy? All right. What'd you say, Carrie?
It sounds like C to me,
Well,
or B.
I'm personally going to agree with the guys. I'm going to say that's a bruise, a contusion, okay? Hematoma is like a puddle of blood in the skin. The epidermis, the outer layer of the skin, remains intact. Small blood vessels are broken, so it's like a black eye kind of a thing. Buildup of blood produces a characteristic blue and black discoloration called ecchymosis. A compression injury that is severe enough to cut off blood flow below the injury is called. You're right. Compartment syndrome. Wasn't it?
Yeah.
Yeah. A 45-year-old convenience store clerk was shot in the right anterior front chest during a robbery. Your assessment reveals that the wound has blood bubbling from it every time the patient breathes. Your most immediate action should be to
A.
What you thinking, Michael? All right, I see an A and I see a B. Carrie, you gonna cast the deciding vote between these two dueling gentlemen? All right, we've got an A, a B, and a C now. Unless you're going with D,
That's
would you
what I was
please cast
thinking, A, B, or C.
What? I meant three different people, each had chosen one. Help her out, Erica and Jessica. We've got an A, a B, and a C.
I'm saying C, but then also A.
Which one did you say? Erica would be correct, and Blake, you said it. A, prevent that air from entering the wound, okay? This is a sucking chest wound. This is the danger of a pneumothorax. Immediate treatment for a sucking chest wound, an open pneumothorax, involves covering the wound with an occlusive dressing, and it might be your gloved hand right off the bat. To prevent air from being drawn into the chest cavity. After covering the wound, then assess for an exit wound, apply high flow oxygen if not already done, transport promptly. These people are liable to have trouble breathing, so give them oxygen. What effects will the application of ice have on a hematoma?
D.
D would be correct. You cool the skin and it constricts to try not to give off heat. So vasoconstriction, so you're going to decrease the bleeding. D. The primary reason for applying a sterile dressing to an open injury is to
C.
huh?
It's kind of a weird
Kind of
question.
tough. Yeah, I agree. Boy, controlling external bleeding sure sounded good too, yeah. I agree since, like Michael said, they're saying sterile. Ha! Well, I say controlling external bleeding sounded interesting, but I thought with the sterile that they were asking for C too. That's one that's just about impossible to guess. It probably says it though in your chapter, and so
Oh,
I'm figuring on
sure.
us haven't read the chapter. Prevention of contamination is an important reason, but the primary reason is control external bleeding. Oh. Pierre, you've gone on an evisceration. What are you gonna do for it? A, B, C, or D? Excellent.
Yeah. Just
Whereas in the burn, we go dry on the intestines or internal organs, you want moist. You don't want them drying out, okay? So moist sterile dressing, and then secure it with an occlusive dressing. Very good. Alright, 22-year-old male was attacked by a rival gang and has a large knife impaled in the center of his chest. Your assessment reveals that he is apneic and pulseless. You should
A. Oh wait, I just read carefully move the knife. Hold on. Let me read the other ones. Yeah, you're right. Let's see. I just looked for the first one that said remove the knife.
Well, A could be right too.
I think you. What? Well, don't say stuff like that. Let's see.
Well, it could be.
It could be A. It really could be.
You can remove the knife and begin CPR.
Mm,
You can hook up to the AD
Huh?
and CPR.
actually,
I'm
I
trying to think
think.
about it again, A or C, but which one do
I
you
think it's A. Actually,
Going back and forth on it.
I think it's A.
I think it's A because it says carefully remove the knife. Like it's very specific.
We're not gonna analyze his rhythm. The AED is gonna do that
Yeah.
while we're doing CPR.
It has to be A.
I agree. I agree. Yeah. Yeah, that's gonna be pretty well inside. Yeah.
Air goes in and out, blood goes round and round, any deviation, you got a problem.
I agree with Eddie and whoever else said A.
See, that's why I don't need to listen to you, dude. I had it right the first time. Then you started.
The AED is not indicated for patients with traumatic cardiac arrest. Their arrest is usually caused by massive blood loss, not a primary cardiac arrhythmia. Remember, we're not jolting the heart and getting started again with an AED or a manual defibrillator. We are actually stopping it and hoping it restarts with a normal rhythm. But this patient not a problem with a bad heart rhythm.
See what that was.
Which of the following is considered a severe burn?
A. Actually.
I don't think it's A.
I don't either.
B?
No,
I'm trying to decide between B and D. I lean
It's
towards
A.
B.
A.
Yeah.
Let's look for it. It's A.
It's a
Yeah,
pediatric rebirth. It's a full thickness.
I may be wrong. You may well be right.
Cause it's highest, it's got the highest infection rate.
you got chances of infection, all the skin, everything's burning away in that area.
Yeah.
They're saying 10%, rule of 9.
Whoa.
I literally just looked at the. Wait, go back. Go back
5%
one.
Fracture.
Which of the following is considered a severe burn? Classification of burn. Oh, that's in infants and children. Not big people.
I was wrong too.
Yeah, I was wrong. I thought it was A. But it's.
Got more liberation now with a fracture.
Well, that one got me.
Where?
5-year-old boy was burned when he pulled a barbecue grill over on himself. He has partial and full thickness burns to his anterior chest and circumferentially on both arms, around both arms. What percentage of his body area has been burned? And you can look at your rule of 9s if you want. You can think with it.
C. Mhm.
The arms are 4.5.
That's probably the interior part of the arm, though.
It said circumferentially. I can't say that word.
So I think you'll have to double that 4.5, though.
Wait, okay, so each arm is 9. Does that count? Is it 9 for the front, 9 for the back? Or is it
No,
just
I think
9
it's
for the whole?
4.5 for the front.
4.5 for the front, 4.5 for the back.
Yeah, so I think each arm is 9.
So 9, 9, 8, yeah, 30, yes, C.
Is 18, so I'm thinking C, but I mean,
Yeah.
it's... Oh!
What? Go back.
The anterior counts for 9. Oh, I was going with the adult. I think
No,
the
it
adult.
says right here that the front is
My
18.
first guess would be.
It says the front is 18 and the back is 18.
On a child?
I'm looking at it right now.
Yeah, it said right there, it said 8, 9.
Well,
8, 9,
here it
that's
says,
what
oh!
Or 18
All
and
right.
9.
Each
The
arm.
entire anterior trunk, which includes the chest and abdomen, accounts for 18. They said only the chest is burned. So they're cutting it in half.
So they're cutting it in half.
Oh, keep that in mind on the test, guys. That had me, that was tricky, had me messed up. I didn't catch that. So it said, from there to there is 18,
So
but they said only the chest.
I said B and then I changed it to A and then I changed it to C.
sorry, bud. I should have just left you alone.
Which of the following statements regarding chemical burns is false?
C.
is correct. Prior to removing a dry chemical, you should flush the area with sterile water. No, you brush off that dry chemical and get the bulk of it off and then wash it. C should be correct. Guys, it's 9:30. Why don't we call it good there? And I